Let's talk about something that's changing the face of medicine. But it's not a new drug or a fancy machine. It's storytelling. In a world that runs on data, we're going to explore how a good story can turn all those numbers into something with a real human heartbeat. Let's get right into it.
I mean, really think about that for a second. What if all that data could talk? Behind every single statistic, every clinical trial, there's a person, right? There's a human experience. This question is really at the heart of what we're talking about today. How we can close that gap between the numbers on a chart and the actual lives they represent. And this lays it out perfectly. You've got data on one side. That's your logic, your hard evidence. And then you have the story. That's where empathy, memory, and real connection come from. Now, the key here isn't to pick one over the other. Not at all. The goal is to give that data a voice, to wrap it in a story so it actually resonates with us, so it sticks.
Okay, so just like any concept in medicine, a powerful story has a specific anatomy. It's not just a random collection of events. No, the really effective ones are built with a clear structure and they're designed to have an impact. So let's break that down. So every single compelling medical story you've ever heard is built on these three pillars. First, you need a character. That's the person we connect with, right? The patient, the doctor. Then you've got the conflict. That's the challenge they're up against, whether it's a tough diagnosis or a research problem nobody can solve. And finally, you have the resolution, the outcome, the lesson, the thing that sticks with you. It's a simple formula, but man, is it powerful. And this is such a key point about that resolution part. It doesn't always mean a happy ending or a miraculous cure. So often the most powerful stories are about finding meaning in the middle of a struggle. They're about acceptance or finding a strength you never ever knew you had. All right, so we've been talking about the art of storytelling. Now let's switch gears a little and talk about the actual science behind it, because it turns out our brains are literally hardwired to respond to stories in a way that just, well, facts and figures alone can't compete.
Yeah, you heard that right. That's a huge statement, I know. But the neuroscience actually backs it up. When we listen to a story, our brains aren't just sitting there passively taking in information. Oh no, something much more active and amazing is happening on a biological level.
So how does this brain hack actually work? Well, first, stories fire up our emotions. That emotional engagement acts like a little sticky note for our brain, saying, hey, pay attention, remember this. Second, this wild thing called neural coupling happens. The listener's brain activity literally starts to mirror the storyteller's. It's almost like a Vulcan mind meld, creating this incredible shared experience. And finally, a good story with an emotional arc can trigger a release of dopamine, which, you guessed it, boosts our focus and helps us remember everything even better.
Okay, so theory is one thing, but where does the rubber meet the road? Let's look at how this incredible tool is actually being used to make a real-world difference in healthcare right now. You know, think about being in the clinic. A doctor who shares a relatable, anonymous story about another patient who went through something similar, that can do wonders. It takes a scary, technical, jargon-filled consultation and turns it into a real human conversation. And that helps ease fear and, believe it or not, makes people more likely to stick to their treatment plan.
And what about for medical students? I mean, they're drowning in textbooks and diagrams. That stuff is absolutely essential, but it's the patient stories that make it all real. A narrative connects that textbook knowledge to an actual person, and that's how you build empathy, a skill that's just as vital as any clinical one.
Then you zoom out to the bigger picture, public health. A campaign that just throws vaccination statistics at you, it might not move the needle much. But a campaign that shares the story of a family protected by vaccines, or one person's honest journey through a mental health crisis, that's what creates a personal connection. That's what motivates people to act.
And here's the thing. Today, these stories have a megaphone like never before. All these digital platforms, social media, podcasts, online patient groups, they become these massive communities for sharing real, authentic medical experiences. Voices that used to be isolated can now reach people all over the world.
Of course, with all this power comes a huge responsibility. We have to talk about ethics because it's non-negotiable. It means you absolutely have to protect a patient's confidentiality. You have to make sure the story is accurate, not sensationalized. And, this is the big one, you must always get permission before you share someone else's story. So when you put all this together, what does it mean for the future? Well, it's becoming pretty clear that bringing stories into medicine isn't just a nice little add-on. It's a fundamental shift in how we're going to approach health and healing.
This right here,
This is the ultimate takeaway. Because when we embrace stories, we're not just communicating better. We're actually rewiring how we think. We're fostering more compassion in doctors. We're empowering patients to be partners in their own care. We can even shape more human-focused health policies. It's a ripple effect that can truly change the system from the inside out.
And it all comes back to this. Every single breakthrough, every new idea, every leap forward in medicine, it started with one story. One patient's struggle that a doctor couldn't ignore, one researcher's observation that sparked a new question. That one single human narrative is always the seed that progress grows from.
So, I'll leave you with this to think about. In a world just full of unheard voices and experiences we don't know about yet, what's the one story out there that could spark the next great revolution in health? What's the story that medicine really needs to hear next?